is MRD and what does it mean for patients?
Yeah, so MRD stands for minimal residual disease. So it means that, if a patient is in complete remission, what it would mean is that I don't see any myeloma cells in the bone marrow, and I don't see an M spike. The M spike is 0 in the blood and in the urine. The light chains are fine. But even with that, there could be some disease that is residual that I cannot see by the conventional methods. So there are 2 methods that have been developed that are able to detect 1 cancer cell in 1 million cells. So if I have a patient that is in complete remission, I can use one of those methods to look, and that will tell me if the patient still has minimal residual disease or not. So the reason why it is important is because there are many studies that have shown that if I can get a patient to be minimal residual disease negative, right? No evidence of disease by those 2 tests that I can explain a little bit more if you want, then those patients are going to do better. Their response is going to last longer and the patients are going to live longer. So nowadays, with our better treatments, we use also that as a goal, right? We say, okay, I'm not only want to get a patient in a complete remission, I want to get that patient to MRD negativity. And we do adjust our therapy to get there. As an example, I can do a transplant, right, in a patient, and 3 months after transplant, I look at the minimal residual disease. If it's negative, then I do Revlimid maintenance, which would be standard of care. If it's positive, I use 2 drugs to try to get that patient to that MRD negativity level. And there are many studies right now, looking at how to adjust our treatment based on response.